again, here to do another video on a Pilates series that I've been doing for rehabbing the hips, the lower extremity, and of course maintaining core strength. Today we're going to do the single leg circles on both sides, and we'll demonstrate how to maintain neutral spine, engage the core. As I showed you in the previous video, you have to create a triangle, and that triangle is your lower abdomen pelvic area. This is the specific area that we work on in Pilates. So it's wonderful to tone up. Not only is it going to keep your spine aligned and straight during exercise, but you'll be walking straighter, you'll feel better, less back pain. So it's all about engaging that pelvic floor in and up and being able to maintain contraction in the upper abdomen as you do the thoracic breathing and expand out through the chest. So without further ado, we're going to do the single leg circles, and we'll start again in supine position. So go ahead and lay down and body check in again. Make sure the spine is aligned. So imagine that grape right under that lumbar region, lower back. So what you want to do is bring that spine to neutral so that you imagine the grape. You've touched the grape, but you don't crush it. So you don't want to create any kind of excess curvature. So you want that neutral spine, not lordosis, not overly sway back, but not rounding the back. So neutral position, don't crush the grape. Then don't forget, as a rule of thumb, your pelvic area is your lower core abdominal muscles that we use in Pilates. So imagine a tray of marbles, and they do not move in any of your exercises. So don't crush the grape, and keep the marbles stationary across the entire table here, the pelvic floor, which basically spans from the left anterior superior iliac spine, which is the hip, okay, and all the way over to the right anterior superior iliac spine. And then the triangle, as you know, the pubic bone right there. So this is the area that we keep nice and engaged. Don't forget, shoulders down and away from the ears, align the spine. Thoracic breath, unlike yoga, you're not expanding from the belly, you're expanding from the rib cage. So this way everything here stays engaged. Pelvic floor stays engaged. Solar plexus, upper abdomen stays contracted throughout the inhale and exhale. So as you inhale, you expand and flare out the rib cage, all right? And when you inhale, you're using the external intercostal muscles to expand the rib cage and bring it all the way up to the clavicle. And as you exhale, remember to pull that pelvic floor in and up, and that really draws in and keeps that neutral spine. All right, so now we're going to start by lengthening the neck, shoulders down and away from the ears. This is neutral spine, and we begin the single leg circle. So the way to do that is making sure the opposite leg, this hip, the glutes, the thighs are really grounded. So push into the ground, that contralateral side. Go ahead and bend the knee, slowly raise it up. Okay, you can flex or point the toe or keep the foot neutral, whatever feels good for you today. Now remember to maintain the hips squared. Okay, don't compromise the table. Don't let the tray of marbles fall. For some of you, your hamstrings might be tight, so perhaps you can bend the knee. Okay, if you can straighten the knee, all the better. So we'll start with the right leg. Inhale to prepare. As you exhale, start medially, go towards the midline, and slowly draw a circle. And this circle, imaginary circle around the ceiling. So imagine you're creating a circle around the ceiling. All right? So again, inhale to prepare. Exhale, go all the way around, and as you come back, you inhale, return to normal. So let's do 5 reps. Inhale to prepare. Exhale. Inhale. Exhale. Inhale. Exhale. And go slower. It's very, very accurate, precise movement. Feel every single muscle in the lower extremity, the quads, the hamstrings working, the glutes, and make sure that the opposite contralateral side is grounded. Make sure the tray of barbells doesn't move. Make sure you're breathing. Make sure the shoulders are down and away from the ears. There's a lot to think about. A lot of precise movement in Pilates. So 5 of these. Inhale and exhale. Inhale and exhale. 2 more. 1 more. So you should be feeling it definitely in the lower extremity. All right, and then slowly bend the knee and bring it down. All right, now slowly extend the leg out, and we're going to do the other side. Bend the knee. So contralateral side, bending the left knee, keeping the right hip down into the ground. Okay, and inhale to prepare. Slowly bring the leg up. This is my hip replacement side, so it's a little tighter. And it's a fresh hip, so I might want to bend the knee slightly. Okay, so if any of you are recuperating from surgery, whether it's knee or hip, that's what you can do. You can always flex a little bit. There's no need to strain the hamstrings. Okay, so remember, maintain neutral alignment here with the spine. Maintain the tray of marbles across the pelvic floor. Okay, always remember to keep the upper abdomen contracted as you breathe into that thoracic breath. All right, so remember we start medial, so we go medial. So inhale to prepare. Go medial, and as you exhale, draw a big circle. Okay, so inhale to prepare. Exhale, bring it back and around. Inhale and exhale. So remember, as you come back around, you're inhaling. All right, and as you exhale, you draw the circle. Inhale, come back around. Okay, so let's do 3 more. Inhale and exhale. Inhale to prepare. Exhale, draw it around. Inhale, come back. All right, so you could do big circles or small circles. I would suggest you start with very small circles, very precise movement. And again, you can bend the knee if it's too much, because you don't want to compromise the alignment here. Okay, so here it is with the knee bent. All right, and try not to do this. Draw the shoulders down and away from the ears. Bend the knees, roll over to the side, and come back up. And that is the single leg circles, both sides.